Are leg kicks the new secret weapon in mixed martial arts?
Maybe.
Today, I'm talking about something that may be the new secret weapon that Israel Adesanya used to pick apart Paulo Costa at UFC Fight Island 2. In the weeks prior to the event, Israel had predicted a second round knockout of Costa. At UFC 253, he delivered on his promise, employing an effective tactic that has become more common among fighters over the past year. So today, I'm going to look at leg kicks and why they are an effective secret weapon in MMA fighting.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you are here because you recently subscribed to my channel, then thank you for becoming a part of the intern army, now 59,000 strong. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. Follow me on Instagram or Twitter for medical stories and content, TikTok for info on medical education, and on my other YouTube channels for my podcast or for workouts and training tips.
If you want to touch gloves, do it now. Come out ready to fight.
Recently, Israel Adesanya fought Paulo Costa at UFC 253 in Abu Dhabi. Israel Adesanya put on a master clinic in this fight, effectively canceling out the aggression and power that Costa normally brings to the fight whenever he is in the octagon. Adesanya used the first round to hold Costa at bay, keeping Costa outside striking distance with frequent lower body kicks. Although Costa is known for bulldozing his opponents with a barrage of power punches, he was not able to get close to Adesanya during the entire first round. In fact, it does not appear that Costa landed even a single head blow during the entire match. After the first round, where Adesanya measured distance and Costa seemed to be bewildered, Adesanya made short work of Costa in the second round by TKO, as he had predicted in interviews prior to the fight. Costa was undefeated no more. This was the first time that Costa had been stopped, and not even on points. Costa had been defeated by blows via TKO, by what was arguably a much smaller man. So, what sort of sorcery had Adesanya employed to pull this off? What was it about his game plan that had nullified the battering ram known as Paulo Costa? And why was this technique so effective? Let's see if we can figure this out. First, let's consider the reasons why the front leg is important in mixed martial arts fighting. The front leg is used to pivot when power punching. The front leg is used to control the direction of movement around the octagon. The front leg is used to control distance between you and your opponent. The front leg is one half of your foundation in your fighting stance. The front leg is used to deliver blows to your opponent. And for all of these reasons, the front leg is extremely important when fighting as a striker. So now let's consider the structures around the knee that might be injured. The structures that may be injured in the leg near the level of the knee include the gastrosoleus complex, or in other words, the calf muscles that include both the gastrocnemius and the soleus, the insertion of the hamstring muscles, the collateral ligaments, the cruciate ligaments, the menisci, and the common peroneal nerve as it travels around the head of the fibula. So what happens after repetitive unchecked kicks to the same area on the calf? After a single blow of sufficient intensity, some of the muscle tissue in the target area will be damaged. This will cause disruption of the cell walls around individual muscle cells and the separation of aggregated or joined cells in muscle fibers. This results in bleeding within the tissue and the release of cell contents into the tissues. It also results in an impairment in muscle fiber recruitment and contraction within the target area. So, basically, you break some cells, releasing cell contents, and this makes the targeted muscle less able to respond to your commands when you call upon it. Less of the muscle can contract, and the contraction is much weaker when it occurs. This whole process becomes worse and worse with each successive blow in the same area. Eventually, with enough blows, the damage becomes extensive. As blood accumulates within the muscle compartment, the pressure within that compartment increases. This increased pressure can affect all of the structures within that compartment, namely the muscle, the blood vessels, and the nerves. Increased pressure on the muscles can cause them to become less contractile, reducing the power that can be generated by these fibers. Increased pressure on the blood vessels can cause them to become compressed, which may decrease or even stop the flow of blood out of and into the targeted compartment. Finally, Just as the increased pressure within the compartment can affect blood vessels, in a similar manner, the pressure can alter the function of the nerves and the blood supply to the nerves, thereby altering their function as well. In extreme cases, the compartment pressure may be high enough to cause an extremely painful condition called compartment syndrome, which could lead to death of the structures in that compartment if left untreated. In transient or exertional cases of compartment syndrome, the function of the muscle and the nerves can be temporarily altered while someone is active or exercising. So what does this mean? In simple terms, it means that with enough kicks in the same area, you can induce a transient compartment syndrome in the calf compartment and the muscle function of your calf goes to crap. No calf function means no push-off power with your front foot. In an MMA fight, that is no bueno. Of course, you can also suffer a direct blow to the common peroneal nerve where it travels around the neck of the fibula, such as was mentioned by Dr. Sutterer. A compression injury to the common peroneal nerve in this location can cause temporary paralysis of the foot and toe dorsiflexors, meaning a fighter will have a hard time picking up their foot off the ground and stopping themselves from tripping over it when walking or moving. This is not good in everyday life. But when in the middle of the octagon with a tactical sniper like Adesanya, this is a real problem. Other structures that could be injured by repetitive kicks to the side of the calf or knee include the collateral and cruciate ligaments. When not checked, kicks from the outside of the knee on a planted foot force the knee into a position known as dynamic valgus. Your knee, and in particular your cruciate ligaments, do not like dynamic valgus. For more information on the effects of dynamic valgus, check out my video on Josh Emmett's ACL injury. I'll leave a link in the description down below. But suffice it to say that repetitive unchecked kicks to the calf or to the side of the knee should be avoided whenever possible. So, why was this technique so effective on Costa? Costa is known for his unending forward pressure and ridiculous power punches. Costa presses forward in every situation, swinging a bag of freaking hammers on every punch. Problem is, he needs a functional front foot to do this. Take that away from him and voila, you have stopped the Costa train. While he does have other skill sets such as jiu-jitsu, he is primarily known for his striking. Adesanya came with a rock-solid game plan. Take away Costa's most effective weapon by taking away its foundation. Brilliant. As Adesanya himself said,
I don't need power. Everyone has power. I have precision.
Other fighters have used leg kicks to good effect in the past, such as Jose Aldo, Thiago Alves, Edson Barbosa, and others. Most recently, Chris Gutierrez finished Vincent Moraes by leg kicks at UFC Fight Night Woodley vs. Burns in May of this year. So certainly the leg kick has and will continue to be an effective weapon in MMA contests. But it appears that with precision, Adesanya has elevated this tool to another level of efficacy altogether. In only one round, Adesanya completely nullified Paulo Costa, allowing him to use his strikes to erase the eraser in the second round. And true to his word, Adesanya left Costa looking rather botched. Is the calf kick the new secret weapon in MMA? Let me know what you think in the comment section down below. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.